Brought to you by Express Care Health and Skin Center. Get in, get out, get better.
Hafidane, welcome back to Healthy Living. Chickenpox is a common viral infection. With the increase in vaccinations in the last few years, the incidence of chickenpox have decreased significantly, but the viral illness still pops up from time to time. What some might not know is that once you have chickenpox, it can reappear later in life as shingles. Here to tell us more is Express Care's Dr. Jitka Lom.
Hi.
Hey, how are you doing?
Good.
First, let's start off with what is chickenpox?
Well, as you mentioned, it's a viral infection caused by the varicella virus. It attacks generally young children. About 90% of cases are in children. And it causes a blistering, itchy, red rash, little spots all over the body, including in the hair and on the face.
I can't even remember when I had chickenpox. It was when I was really, really young. But
yeah.
People often say that chickenpox in adults can be extremely severe. Why is that?
Well, I think the exact reason why is not really known, but we do know that deaths actually can occur in adults from chickenpox. It seems that if you catch it in your youth, your immune system is better able to cope with it, whereas later on in life it can become an overwhelming infection, kind of like the flu. Actually, chickenpox in infants is also very dangerous, and that's why we give them their vaccination at around the age of 1 year.
What about in pregnant women who have chickenpox? I understand that it also can cause problems for the baby.
Absolutely. It can cause birth defects, and that's why we, again, recommend that women of childbearing age either get vaccinated if they haven't had the chickenpox, or be very careful and not be around people that have the disease.
And for people who don't know, and maybe even first-time moms, what are some of the symptoms and how long is someone contagious?
Okay, so in general, the chickenpox will begin with like a mild sort of flu-like symptoms, little low-grade temperature, body aches, not feeling quite very well. And then after a couple of days, the rash will actually break out. And then the fever can be a little bit higher, 102 even. And then the bumps will begin. And the bumps start as like just a little flat red bump, and then it can become raised and almost like a blister. Eventually the blisters crust up, and then there's just scabs. Those fall off within about a week. So to answer your question about contagiousness, you are contagious from about 1 week up to 2 weeks from catching your rash.
And is it highly contagious, and how does the virus exactly spread?
Yeah, it is really contagious. So if people are coughing and sneezing and even just breathing, it's spread through that airborne contact. So the virus will be in the air, and then you'll breathe it in, and it'll go into your system and cause the chickenpox. So in children in small enclosed spaces, like in schools or in daycares, that's how it can spread very quickly there.
Is vaccination the only way, I guess, to prevent its spreading?
Yeah, pretty much. If you wash your hands, of course, that's incredibly helpful for preventing any disease, but vaccination is recommended for children at the age of 1, and then there's a booster shot later.
Now, I mentioned it a little bit earlier. What exactly is shingles?
Oh, shingles. Okay, so let's say you get the chickenpox as a young baby or a young child. Your body will overcome that. Your immune system will suppress the virus, but the virus is remaining in your body for the rest of your life. It's just not active anymore because your immune system has contained it. And the virus remains in the nerves near the spinal cord. So it stays there for the rest of your life, and your immune system again is containing it, taking care of everything. But once in a while, if you get very tired or weak or sick with something else, or just really stressed, your immune system will stop paying attention to that varicella virus, and then it takes that opportunity to come out again. This time, it doesn't come out as a full-blown body rash. It comes out as just a segmental, meaning just a piece of the skin with a bunch of red blisters that can be incredibly painful. And that can occur, it always only affects one side of your body and only one piece of skin. So it could be even on your face, on your arm, on your bottom end, on your leg, any part of your body, but just one side of your body. And that rash can last up to 6 weeks, and the pain from that rash can even last for several months. So shingles, again, is a disease where your immune system has become too weak, and that varicella virus took the opportunity and came back.
Now, how is that treated?
Shingles, we treat, of course, the pain from it, and the blistering rash, nothing really works on the outside because this is a problem that came from the inside. So we give people medication, antiviral medication, acyclovir would be a name that you might have heard of, and they take the pills to help their immune system again, knock down that virus and sort of chase it back to the area where it was back in the spinal cord area. And shingles can come back though, so there is actually a vaccine that you can get also called Zostavax. It's recommended for people over the age of 60 to prevent the varicella virus from coming back.
Okay. Well, we have got to take a quick break, but we pick up our discussion on chickenpox and shingles when Healthy Living returns.